It's our first day in the clinic. It's actually Sunday, and they were nice enough to bring staff in for us. I think you saw the waiting room is absolutely packed with people, a lot more than we expected. So we're hoping to get people set up for surgery on Monday. We're not able to operate today because it's Sunday, but we're going to at least get started tomorrow. And what we'll do is examine people and get them all set up, make sure that cataract is their visual problem and it wasn't something else. Every once in a while, you'll see an eye that went blind for some other reason. You don't want to do cataract surgery if it isn't going to help. So that's what John and I are trying to determine today. We're trying to figure out the best way to go about seeing all these people. As I was saying earlier, there's always some element of chaos when you get started on these things because there's everyone that wants to get seen, and there's we have to figure out how we're going to get them through here and get them all seen timely.
Normally we've got time to several months to get the word out that we're coming down with a team. We only had 24 hours with this, but still, since we've been down here in the past, they were able to get the word out pretty well. And we've got, take a look around, because of the lack of supplies, the lack of lenses, the lack of suture, medicines to be able to do the surgery. So this is just the first day. There's probably 40 or 50 people out here, and we're trying to line up the first 10, and we're going to examine them for the cataracts, measure them for cataract surgery, and plan to do most of these people's surgery tomorrow. And every day should be very similar to this, in the fact that hopefully we'll have about 40 patients to operate on every day. So it looks kind of crazy, but it's pretty rewarding. Some of these people have been blind for 5 and 10 years and longer than that. They just haven't had any opportunity to see. So
putting drops that make the pupil dilate, get bigger, so they can do a nice exam of the eye and make sure that check the retina and make sure it's okay, and it's a healthy eye to, besides the cataract.
The length of the eye is one of the refracting areas of the eye to determine how clearly they see with the lens that's in there. So we'll use in our lens calculations to know what kind of implant to put inside the eye. We measure both eyes so we know that they're pretty much alike. And if they're not, then there may be some other thing going on inside the eye. So I'm measuring first the right eye, then the left.
This fellow only has one good eye, and the cataract's so dense it's hard to even see into the eye, so he's going to be a little higher risk of surgery tomorrow. He's already seen the retina specialists here, and they said the retina's okay. He's diabetic, but he only has one eye, and so they brought him in for us to do the surgery. So it should be a big impact on him tomorrow.
We had another list for
we're basically have the process made of measuring the patients for surgery. Most all these patients are blind, and we're getting measurements here for the front of the eye and measurements of the length of the eye, and from that we're able to calculate what the strength of the implants that we're going to use that'll give these people good vision. So hopefully afterwards many of them won't need glasses, aside from not being able to see even with glasses at this point. So there's a point where we have to triage. A lot of the patients that we see are blind in both eyes, and we have limited resources, and we're only here for a few days, so we try to triage to do the worst people. And if someone has one good eye, we may defer those people to later in the week, so that way we can work on people that are totally blind. If we had the resources to do everybody, obviously everybody deserves to be able to see out of 2 eyes. But if you only have resources and you have to pick between doing one eye on 20 people or both eyes on 10, we'll try to do more people to get at least people with some sight. This is our first day of surgery. We're just getting here in the morning, and you can see they got a line. You can see they got a line out the door. These are all patients that have come. They've heard we're down here and coming to get screened. This is kind of a typical look of how things are.
Actually, more than we expected for such short notice, so we're excited about it. It's going to be a lot of work, but at least, our goal of being here is to help as many people as we can. And if the patients don't show up, we can't do that. So we're just blessed to have as many people show up that we can help them.
Yeah, the sad thing is, unfortunately, there's an endless supply of blind people down here that can use our help. So,
and the good news is Dr. Stahl's coming today to help us. He's flying here from Miami. He's changed his plans, so we have reinforcements coming in.
What I'm doing here is we're trying to triage these huge number of patients here. So I'm going out and actually just, some of these patients are so blind I can tell they got a cataract just by using my little light. So I'm marking their eyes, and then we're going to try to send them through so that we can start to get them examined. So it's kind of chaotic. ¿Cuál es peor?
¿Cuál es el peor?
Este ya está operado.
Sí.
Ya está operado.
¿Puede ver aquí?
No, este está operado.
Sí, sí, sí.
Borroso también, porque dicen que está sucediendo.
¿Este es turbio?
Sí, turbio.
What we're doing is a lot of these people are coming in with bad vision and they don't know whether they need glasses or whether they have cataracts. Most of the people that we're seeing have cataracts, and a lot of them are being brought in by their families because they can't see. But some of them don't have cataracts. They've got pterygias, are a growth that can grow across the cornea, and they're very common in the tropics and in sun and dust, and it takes a different type of operation to get rid of those, and what we're primarily trying to do here are cataracts. A lot of people have complaints of pterygia down here, but we don't usually operate on it. It just makes the eyes red and itchy and burny, but unless it's crossing across the pupil, we don't usually operate on those because they've got a high rate of return. So what we're trying to do is find mostly the cataracts out of it.